webinar on everything you need to know about cervical cancer with Dr. Bhawna Sirohi. So a little introduction about us, who we are, Apollo Shine Foundation. So we are a student health initiative by the Apollo hospitals, and we are present in 100 plus schools and colleges across India. And we have close to 1.5 lakh students with us and around 15,000 teachers with us. And the very reason Apollo Shine Foundation came into existence is to spread awareness and fight against NCDs, that is the non-communicable diseases. So that is why we have joined hands with Apollo Proton Cancer Center to increase awareness about cancer and to encourage screening. So now I introduce Dr. Bhawna Sirohi to all of you. She is a leading medical oncologist, and she has, with an exemplary experience of more than 25 years, she's a renowned senior consultant with top institutions across the globe, and she's worked with top oncologists and senior oncologists around the world. And currently, she is the lead medical oncologist with Apollo Proton Cancer Center. So this is how the session will go. Dr. Bhawna will be talking to us for 15 minutes, and post that you can ask all your doubts directly to her. Either you can unmute yourself and talk to her directly or drop your questions in the chat box. So over to you, Dr. Bhawna.
Thank you, Shalina. Good evening, everyone. I am going to share my screen. It's a pleasure to be with all of you today. And I mean, some of you who know me know that I'm passionate about early detection of cancer and also prevention of cancer. And I think this is a problem that is very common for us in India. And I'm going to talk to you for 15 minutes because we want to have this as an interactive session so that you can have questions. And I see each one of you as a leader in influencing your sphere, especially the parents you come in touch with, the students you come in touch with, the public you come in touch with. So I feel that by talking to you who are leaders of influence, we should be able to create a ripple effect and influence a larger group of the Indian population. I'm going to talk a little bit about cervical cancer. I will discuss some risk factors. Risk factors are what can increase the risk of a lady getting cervical cancer. What is screening? What is the vaccine that we have available against cervical cancer? What are the challenges to implementation of these? And then I will conclude. So basically, just to give you an idea, Australia and New Zealand and possibly Malaysia are some of the countries which may have eradicated cervical cancer. We have eradicated polio as a virus and as a problem from India. And my dream is that we are able to eradicate cervical cancer as well. And we can only do it if we all work towards that goal. So 1 in 5 men and 1 in 6 women will develop cancer before the age of 75 years. In a country like ours, cancer is becoming more and more common. And because of our population matrix, we see more patients than anywhere in the West. What is cervix? So cervix is the area just below the womb, which is the uterus. And then below the cervix is the vagina. So when we do a pap smear or a test, a speculum is introduced into the vagina and the cells are taken from around the cervix to diagnose cervical cancer. So 1 in 4 global deaths that happen from cervical cancer actually happen in India. It's more common in rural India. 1 in 7 to 10 ladies in rural India develop cervical cancer. 1 in 20 women in the urban or semi-urban areas develop cervical cancer. Breast cancer is more common in urban and semi-urban India. And if you want, I can take questions on that during our Q&A session as well. What we know about cervical cancer, we have a very clear cause. More than 80% are caused by this human papilloma virus, 16 and 18. There are more than 100 types, but these are the two types which commonly cause cervical cancer. We understand the biology very clearly. We know how it progresses, how from infection to precancer to cancer. It does lend itself to prevention and early detection because it happens in an organ which is easily accessible. There is actually a window period of 7 to 10 years when a lady can be screened to detect a precancerous lesion which can be treated before it becomes cancer. Majority of the cancers in India are diagnosed at late stages, not just cervical cancer, but breast cancer and all the other cancers as well. And like I said, to change the dynamics, we all as a nation have to work together. Why are we so keen on diagnosing a cancer early? By early, I mean that the cancer is confined to the organ where it is originating from. So if it is cervix, the cancer is confined to the cervix. If it is breast, it is confined to the breast and has not gone outside. So if it has spread, then it becomes late stage. And the later the stage, the cure rates go down, the cost of treatment is very high. And I'm going to put a fourth section as well, that the duration of treatment is long. With most early cancers, we can cure those cancers by treating patients for an average of 4 to 6 months. But if a patient has an advanced cancer, some of the ladies can be on treatment for life. So automatically the cost of treatment goes up. Our 5-year survival, how we define, we have certain matrices, how we look at how effective our treatments are. We look at how long a patient is surviving at 5 years. And what we know that our survival figures or our outcome measures are the worst in the world. And that is because we are diagnosing cancers late. So we need to diagnose cancers early. So I would say we need to do a stage migration so that our cure rates are higher and our outcomes are better. How can we diagnose early? We can raise awareness, and this is why this event is so important. And I'm really grateful and thankful that you are here on a Saturday evening. We need to talk about cancer. We need to remove the stigma. Cancer does not mean death. And I always say that in Bollywood or Hollywood films, when somebody has to die, they make sure that the person has cancer, which is very wrong. A wrong message goes out because diabetes uncontrolled can also lead to kidney failure. And cancer, if detected early, is curable. We need to raise awareness about cancer symptoms, and we need to encourage people to go to a physician. Just very briefly, the symptoms of cervical cancer are unusual bleeding or discharge. So especially if you are young or premenopausal, you start bleeding in 2 weeks' time or more often, or if you've attained menopause or you have stopped your periods, then starting bleeding is a warning sign. And this is something that you must not ignore. Even if you have one episode of bleeding, you must take advice. If you have bleeding from the urine, it could be bladder cancer. So these are the warning signs. Anything that does not get better over a period of time, whether it is change in bowel habits or bladder habits, like, if you are passing urine at the night more frequently or during daytime, or if you have constipation alternating with diarrhea, or, if you have an annual checkup and your hemoglobin is on the lower side, it may be just something very simple as iron deficiency anemia. But it could also be colon cancer. It could also be blood cancer. So all of these, at least have this on your radar, because cancer, the incidence of cancer is rising. Human papilloma virus, very briefly, is what causes cervical cancer. About, I would say, 99% of cervical cancers are caused by it. And we have actually typed the virus as well. And against the virus, we have developed a vaccine. Like you have the vaccine for polio, we have the vaccine for hepatitis B. We also have the vaccine for human papilloma virus, and it is not part of our national immunization schedule. Hence, the reason why we are talking about it today, so that we can implement it as widely as possible. So HPV 16 and 18 cause more than 75% of cervical cancer and also vaginal and vulval cancers. And 6 and 11 also cause warts in the anal and the genital area. This pictogram actually very clearly shows you, once a lady is infected or a girl is infected with HPV, there is a long duration, at least 7 to 10 years before it turns into cervical cancer. So any intervention at 1 year, 5 years, or 10 years can pick up a precancerous lesion. The precancerous lesion could be a low grade, which then if left untreated, especially if there is persistent HPV infection, can lead to high grade. Persistent infection can lead to cervical cancer. Majority, I would say 90% of ladies or girls are able to, within 3 years, get rid of this infection. So it's a self-limiting infection. And how it is self-limiting? It can be self-limiting if you look after your diet and exercise for prevention, because your immune system is stronger and you are able to fight the infection. So risk factors: smoking does affect your immune system. Any kind of tobacco, actually, it could be smoking or smokeless, which will affect our immune system and increase the risk of cervical cancer. Like I said, persistent infection with HPV will increase the risk, and one can detect this by a simple screening method, which I will talk about. Multiple sexual partners or early age at sexual activity, having more number of children, other infections will also lead to chronic infection. And that chronic infection, along with the human papilloma virus, can increase the risk as well. Poor nutrition. If you have a poor nutrition, a diet which does not include fruits or fresh vegetables, that can also suppress your immune system. I went to a village, I remember a village in Rajasthan, Thamblau, a population of about 1,500. There were a lot of kids who had never eaten a fruit or not had milk as well. So these things will increase the risk of developing vitamin deficiencies and also cervical cancer. Long-term use of oral contraceptive pill can increase the risk as well, because it changes the milieu, and there may be persistent HPV infection. Lower socioeconomic status, again, non-availability of fruits, vegetables, milk, and other nutritious diet. How can we prevent it? We can prevent it by screening. I'll talk about vaccine and also reducing the barriers. Screening is not a test for cancer, but it actually detects and treats early abnormalities, which, if left untreated, can lead to cancer. The first stage is doing a simple examination from cervix for analysis. Now, we live in a country which does not have universal health coverage. When I was in UK, I was there for almost 2 decades. I remember that when I had just gone there, my GP kept on calling me to have the pap smear test done. Until I had it, I was literally, almost called every week by the surgery to come and have the test done. And I will talk about the frequency of the test as well. Early detection and treatment can prevent 80% of cancers. Screening, there are various methodologies. When we talk about screening, we look at how sensitive the test is, how specific the test is. Sensitive is you have less number of misses, you have less false negative. Specific means you know that we are able to accurately say that this individual does not have cervical cancer. So there are 3 ways one can test it: cytology, HPV based, and the visual exam. And I'll just briefly talk you through it. Cytology based are pap smears, which you must have heard about, and there are different types of pap smears one can have. It depends on the experience of the pathologist. So, it has poor sensitivity and there may be more misses, but, it has good specificity. HPV DNA test requires a specialized lab. It's about a couple of ₹1,000 more expensive, but has very good sensitivity and specificity, and you have self-sampling kits as well available that you can do the test at home. Visual-based screening for a country like ours is very important in rural India. I tend to do this when I go to the villages for screening. It is cost-effective, but it needs a lot of training, and there is poor sensitivity and good specificity. One can visually just inspect the cervix by applying vinegar or Lugol's iodine, or you can apply acetic acid or vinegar with magnification. So this is quite cost effective. And when we want to screen a lot of ladies in a village, it's easy to do because we don't need to make slides and bring it back to the hospital, which is what a pap smear needs, and needs a specialist pathology input as well. When should you start? If you're going to have a pap smear, the age to start is 21 to 65. Start at 25 and then, have it every 3 years till 65. If you do the HPV DNA, which is more sensitive because it looks at the virus, you start at 30 years and you repeat it every 5 years. Visual exam, again, between 30 to 49 years only, should not be done in ladies who are postmenopausal because we do not get the right information. And because the sensitivity is low, we should do it annually. We should do it every year. As far as the vaccines go, there are 2 vaccines which are available, which are quadrivalent or bivalent. There is a nanovalent as well, which targets the 9 viruses. It is not available in India, but the 2-valent and the quadrivalent is available. They are available and they are endorsed by the Indian Academy of Pediatrics. Every drug, every vaccine, including the COVID vaccine now we are taking, has a downside and a side effect. But if you compare the side effect of the vaccine versus the cervical cancer, you will see that cervical cancer left untreated will lead to death. But loss of fertility, surgically induced menopause, bowel complications, radiation-induced cancer. So a lot of side effects relating to the cancer. But the vaccine, very rare side effects. The main side effects could be flu-like symptoms, a fainting spell. So I think it's worth considering it. 7 to 8 out of 10 cancers are prevented with the vaccine, and ideally should be given in young girls who are HPV naive, who haven't had a sexual contact and have not been infected with HIV. In those girls, the protection is almost 98%. I remember all my friends' children in school in UK got the vaccine in the school. In fact, in UK and Europe, all the boys and the girls get the vaccine, and it is given in school as part of the national immunization schedule. I think the reason why we've not implemented it in India is because of cost reasons. And there are few states like Punjab and Delhi and Meghalaya who had implemented it. And we are making a case for Tamil Nadu and Karnataka government as well. Because when the government buys the vaccine, you get it for less than $5. But if an individual buys it, it costs about 3,000 rupees. So it prevents warts, it prevents oral cancers, and it reduces both initial and persistent HPV infection and protects against both moderate to severe precancer as well. Dosing frequency is, if the girls get it for between 9 to 15, only 2 doses are recommended. 1 dose now and then 1 at 6 months. But if you are above 15, then 3 doses are recommended at 0, 1, 6 and 0, 2 and 6 months. All these societies, including the Indian Academy of Pediatrics, NHS, FDA, Europe, WHO, everybody has endorsed vaccination for girls. The barriers to screening, I think, in our country is shyness. We don't like talking about it. We don't even like saying the word. I think this is something we need to talk about, and only then we will be able to mitigate it. There's reluctance to engage with the word cancer. And including a lot of patients I treat, they would not like to, they would say the word infection. They don't want to say the word cancer. There is a fear, but like I said, we need to change the dynamics. If detected early, the cancer is curable, and we need to increase awareness by talking like this and prevent cancer. I always show this slide because this is something which is in our hands completely. This applies to cervical cancer, but also to all cancers. So A is for avoiding tobacco, excess alcohol, sun, long periods of contraceptive pill or hormone replacement therapy, processed foods, supplements, and high sugar. There is implication that high sugar or refined sugar is linked directly to diabetes, heart diseases, and cancer as well. At least for breast cancer, there is evidence. B is for be vaccinated and against HPV and hepatitis B, which will prevent these cancers. Use barrier contraception. Be breast aware, very important that you know what is normal for you so that you know when there is something abnormal, like a different size, shape, bleeding, you will take advice. Breastfeeding for 6 months is recommended. Calm and compliance. Again, there are a lot of studies coming out from the West now to show that mindfulness, meditation, yoga, at least for breast cancer, there is a decreased incidence in the population. Diet, again, antioxidants, there is evidence. Balanced diet, which is colorful with different colors, fruits, vegetables, milk, is important in prevention of breast cancer. Saturated fats should not be taken. Exercise 30 to 45 minutes a day is recommended by WHO for prevention of common cancers because you produce different endorphins, which does help with your immune system, and the immune system then can fight off with the abnormal cells that may be produced as a result of any environmental injury or a genetic reason. Very important to know your family history and take advice if there is family history of cancer. Sleep is linked, at least if you have 2 hours of between your last meal and sleep, between supper or dinner and sleep, there is a 20% decreased risk of prostate and breast cancer. Screening, again, is very important. 4 cancers lend themselves to screening. One is cervical cancer, which I've talked about. Second is colon cancer. A simple stool occult blood test can tell you that whether you have a possibility of a colon cancer, which is rising in Indian metros now. Breast cancer is mammogram can be done, and it should start at the age of 50 years and should be done every year. Between 40 and 50 years, one can do it every 2 years. And the 4th cancer, which lends itself to screening, is patients who smoke can have a low-dose CT scan of the chest to detect early lung cancer. So I think coming back to cervical cancer, try to get at least one high quality screen, which is very important. I think being a community leader as teachers, principals, you can make it happen, at least to drive the vaccination in schools. I remember doing it in Delhi in a few schools where it was easy to do, does need parental consent, and does need these kind of conversations and answering any doubts that are there to increase vaccination amongst the school girls, and also increase vaccination does not mean that you should not have screening. When the girls get married and later on, they should have screening. And I think I urge all of you as well to make sure that you at least have one high quality screen. I think HPV is one of the viruses that we can all beat. Thank you. I think we'd be very happy to, you can put the questions in the chat box, or if you have doubts or concerns about especially the vaccine or even the screening, I'm very happy to take them.
So you can either unmute yourself and ask your questions directly to Dr. Bhawna, or put your questions in the chat box. She'll be happy to answer you all.
I think all the teachers are very, very familiar with Zoom because all the classes are happening on Zoom nowadays.
Any questions?
I think, I mean, I don't know whether one of you would want to take it, whether you would consider vaccination in your school is something. Can we go for vaccine without going for screening? So, you know, so vaccine is only recommended for if you've not had a sexual exposure. So if you are married and if you have had a sexual exposure, then I would not recommend you have the vaccine. So I would suggest that screening cannot replace the vaccine. A vaccine is unlikely to be effective if you're already infected with the HPV. So the right age for vaccination, Pamela ji, is that the earlier the better. So I would suggest, the WHO says only 2 doses are okay if you do it between 9 to 15. So I would say at the age of for my nieces, I've given it to them when they've turned 11 to 12. I think that would be the right age. And every country the WHO recommends has to define the right age. So it's, when the sexual activity starts. In the West, it's usually earlier. So, but I think in our country, we can start with 10, 11, 12, 13. That would be the right age. But after 15, you need to have 3 doses of the vaccine. And if you are living in an urban area, I would suggest, you just go for the HPV DNA test, because I know I've had the smears, the test is uncomfortable. So I would rather have it every 5 years than every 3 years. So one could just go for the HPV DNA test, which is about 3,000 rupees, or even lesser in government centers. But I would suggest have access to that. My daughter is at the age of 19, so maybe go for the vaccine now. Yes, you can, because the vaccine is approved till the age of 26 years. What about women 45 and above? Again, if you have not had any sexual exposure, this is something you can think about with your gynecologist and have it. But the recommended age is 9 to 26 years as far as the approval is concerned. So I had colposcopy done in the year 2015. HPV was negative. I went for it because I had discharge after sexual. I was detected chronic cervicitis. I do not worry because the virus should still be. So I would suggest that you have the HPV DNA test again in 5 years' time. So it's already 5 years. You should go for a repeat HPV DNA test. So my question to you, could put on the chat box, would you educate your school girls to have the vaccine? I mean, I am completely in favor of the boys also being vaccinated. So I vaccinated all the boys in my family and the girls as well. So because, this is something, you have a vaccine against a cancer. Why would you not do it? So I want to keep doing this till we eradicate cervical cancer. It may not happen in my lifetime, but hopefully it will happen sometime. So again, like I said, 3 doses are recommended after the age of 15 years, but between 9 and 15, only 2 doses are recommended by WHO. In fact, the study was done in India by Tata Hospital, where half the girls got 2 doses and half the girls got 3 doses. And they found that 2 doses were equally effective. Now the trial is being done to see whether only 1 dose is effective, because if we are going to go to the villages and vaccinate, then giving 1 dose would be fantastic. It would be cost effective as well. Can the vaccine be administered at the school or college premises? Of course, yes. I mean, if you would like to do it, you can get in touch with the Shine Foundation, and we can work out something. I have done that previously in some schools where we have worked with we've engaged with the parents at the parent teachers meeting, and because parental consent is very important, and they just fill a form in, and then the kids can be vaccinated in the schools or the colleges as well.
What is the gap between each dose? Question from Ms.
I think if you have the quadrivalent one, which is what I suggest, it's 0, 1, and 6 months. So, but if you're between 9 and 15, it's 0 and 6 months. So if a girl has a vaccine today and she's 11 years old, the next dose will be due in 6 months' time. So my advice would be to go for, 11 to 12-year-olds. And then, so I think that would be 6th, 7th standard. in our country. And should one go first, get the HPV test and then go for the vaccine? No. So I would not suggest. HPV test is done through the cervix, through the vagina. So I would not suggest doing that in young girls. I would suggest that I would go for the vaccine. Screening does not replace. So when the girls have had the vaccine, but when they get married, have kids, and they should start having screening tests done. If they want to do HPV, they start at the age of 30 years, every 5 years. Is it right that acidic environments enable tumor cells to strengthen through protein production? So actually, there is a lot of research and a lot of papers being done on alkaline diet. And but I think this is not something that one can recommend as that you should not have an acidic diet. It's very difficult to say, because there are no studies to say that that this is the case. This may be true in animal models, but has not been shown in clinical practice. If second dose is missed, then what is the schedule? Should we repeat? No, I think you just get the second dose at whatever time you have missed it. If you've missed it at 6 months, take it at 7 months or 8 months. I would suggest that. But go ahead with the second dose. So, it's not such a big deal. Like I said, we are trying to see if one dose is enough. So we don't have the data yet to recommend one dose. So right now, I would suggest in young girls, 2 doses should be given.
Any more questions?
It's such a pleasure to see about 140 teachers join in from all over India. I mean, I'd be so grateful if you could. I think I will share the slides with Shine. I think I always believe in educate the educators. I would be very happy for you to share these slides with your students or your parents, and because this is not rocket science, this is all evidence. And I'm sure Shalina would be very happy if you drop her an email or send us your email to share the slides with you. And
yes.
Because the more people you educate and talk to, it has, like I said, a ripple effect, and more people will come for vaccination and also for the screening. Even if it is, like I said, once in a lifetime, it's worth it, because you can detect the precancerous, and at the same sitting, the gynecologist can either cauterize it or burn it or cryo it and treat it at the same sitting, and then that's done.
So I think the very reason we wanted this webinar for the teaching community is because when the teachers learn something new, it always multiplies year
Yes.
after year with different set of students.
Yes.
So I think only the teaching community has that kind of superpower. So that is the reason this webinar was for the teachers, the teaching community.
So, what should we consume to reduce acetic acid or alkaline? So again, there are a lot of stuff. They say take apple cider vinegar and all of these things which are alkaline diet. I think if you Google, it would give you a lot of options for alkaline, so making your body alkaline. But I think I would not go to any extreme. The most important thing is to have a balanced diet, which has adequate amount of carbohydrates, fats, proteins, vitamins, and minerals. Does this vaccination cause any side effects? Yes, it does. And as with any vaccine, it does. And one may have, pain at the injection site is the commonest. And sometimes girls may have a fainting spell. And so, it's that is what has been shown. But it is very safe to take. Like I said, it is given to every girl who's in the school in the Western society, and very well tolerated, endorsed by every single national and international body one can think of. And like I said, some countries have eradicated cervical cancer, and they have done that, by vaccination and screening. Both of them don't replace each other.
So we still have some time left. You can ask your questions to Dr. Bhawna.
If any of you want, I'm very happy to talk at your parent teachers meeting as well, because I've done that before, because it does help to convince parents if you want to do a vaccination drive in your school. And if one is suffering from skin allergies, would it cause any side effects? I'm not aware of it. There is no contraindication to the vaccine. So in India, there was something a few years ago. It's before, about more than a decade ago. So I mean, I think you have anti-vaccine lobby in every school and every parent-teachers group. So for MMR vaccine, there's a lot of stuff. So I think it's much. I would say it's a safe vaccine to take.
Is the vaccine effective after 50 years of age?
No, I wouldn't give it for after. So again, this is a discussion you can have with your gynecologist. But like I said, if you've had sexual exposure, I would not recommend it. And but if you would like to discuss it with your gynecologist, some of the American Cancer Society is a revenue-driven model, that recommends quite a few things. So not American Cancer Society, sorry, the American guidelines, I would say, because they do recommend at a later age as well. But I would say, between 9 to 26 years would be the right age. Even if you have thyroid, it's not an issue. One can have it. The vaccine is given for boys also. Yes, it does prevent penile, anal, and oral cancer as well. In fact, all the Western societies and schools, like I was in UK, the vaccine is given to all the boys as well. And like I said, I've given it to my nephews as well. I had hysterectomy, so no need for vaccine for me. So a vaccine is not recommended. So no, your cervix would have been removed. So no need for screening, I would say.
So we are receiving a lot of thank you messages already for
Thank you.
webinar.
Is any other vaccine for adults regarding as right age 19 to 26? So I think hepatitis B is the only vaccine which is recommended for adults if you've not had it as a child. Lung issue like asthma, no, I think there are no issues with the vaccine. The main symptoms of this cancer are, bleeding, vaginal discharge, abdominal pain. So mainly it's bleeding at the time of month when you should not be bleeding, or bleeding after sexual intercourse. So these are the main symptoms that this cancer presents with. Initiate a drive regarding vaccination and its advantages on the schools in Rajasthan. Yes, I mean, we would love to actually. In fact, I was speaking to one of my dear friends from Rajasthan yesterday itself, and I said, we have to from Apollo. I think we are starting a drive of within the cancer centers of adopting villages in various cities where Apollo centers are, to mainly shift the needle towards early diagnosis of cancer. And I would love to. I mean, I hope Shalina is keeping tab of this, and they'll be in touch. So anybody having frequent infection is more prone to have this cancer? No, I think if you're having frequent infections, you must look after your immune system. You must take advice, see a physician, exercise. I would say exercising every day, even if you walk, which is a brisk walk, which gets your heart rate up. So the day I miss my exercise, I know I do 3-4 times a week, and I feel different the whole day when I've exercised. And the day I've not exercised, I know, I mean, you feel different. You feel, because your body produces different endorphins. Cancer is all about chronic injury, whether it is the bacteria H. pylori causing injury in the stomach, leading to stomach cancer, tobacco causing injury in the lung, or mouth causing mouth cancer or lung cancer, virus causing injury in the cervix. So this constant injury, can make the cell go haywire, and it starts dividing abnormally. And that abnormal division leads to cancer. So if you are able to get rid of this abnormal division by your immune system will get rid of small 1 or 2 abnormal cells. But if your immune system is not strong enough, that 1 or 2 abnormal cells becomes millions of cells, and that becomes cancer. So I think we have to do all we can to make our immune system robust. And the only way one can do that is by diet and exercise, and not having bad habits like tobacco and this. How to stop white discharge at age 16 and what is the reason. So some of the girls, young girls can have an increased discharge. Again, if it is not foul smelling, I would suggest at least once see a gynecologist so that she can rule out something sinister. And if it is not foul smelling and it happens just before periods or at the time of periods just after, it's nothing to worry. And especially if you have no pains and no other problems, I wouldn't say it's anything to worry. But if it's foul smelling, or I would suggest you at least see the gynecologist once. So I'm going to add my mobile here. I'm very happy for you guys to, WhatsApp me directly as well. 9756999976, and I would suggest getting in touch with Shine if you would like me to do any other, me or my colleagues, all around the Apollo ecosystem. We have 14 cancer centers, so that is the big advantage that we have. Yeah, so you are most welcome to WhatsApp me if you have any specific doubts or anything that you would like to ask or for us to arrange for you. So
any suggestions for women above 65 years of age?
So above 65, I would suggest having if you're sexually active, you should have a pap smear and follow the same guidelines for HPV DNA every 5 years. And also I would suggest having a mammogram done every year, once a year, at a place which has a digital mammogram, and also a stool occult blood test every year. It's a simple stool test, doesn't cost much, It will detect early colon cancer. And like I said, colon cancer and breast cancer is rising in India. So this is such a simple test, that, and there are two methods where you do the colon test. You must do it where you have the fecal immunochemical method, because you need only one stool sample. If you do it by the old method, you need at least 6 stool samples, 3 separate bowel movements. So I think we've started this at Apollo Chennai, and it's available in Max in Delhi as well, the fecal immunochemical test. So I would suggest have the immunochemical method. And if it's not available in your city, I would suggest have the old method only, but give 3 stool samples. But get it done, because if your stool occult blood is positive, you need to have a colonoscopy. It could be simple piles or a polyp, but you need to, address that.
So somebody is
asking, can they get a recorded video? Yes, I think Shalina from Apollo Shine should be able to share that. Would you be able to share that on your website?
Yes, definitely, ma'am. The video is recorded and it will be up on our Facebook page and our YouTube as well. So you can watch it anytime.
Yes, great. Thank you, Kishore. It's I think I did that in London as well when I was there. I shared my numbers and people were very shocked and surprised. But it takes me half a second to reply to a WhatsApp message. If you call me, I won't answer. But WhatsApp, if you ask me to call you, I will definitely answer at some point.
It's a very, very nice gesture from you, ma'am, sharing your number in a webinar.
No, they're all teachers, they're all leaders and principals, and they will influence thousands more. So it's something, I thank you so much for joining. Actually, we are really, really grateful. Thank you. Great. I think we've answered everything, Shalina. So we'll wrap up.
Yes, we can. So before wrapping up, I want to thank you for shedding light on so many things. And I think this has turned out to be a very, very informative session, and we can see the response already. There are a lot of thank you messages coming up. So thank you, Dr. Bhawna, for your time and for joining us today. And a request to all our participants, one announcement. There we have a post-webinar quiz up on our page, Apollo Shine Facebook page, where you can go and do the quiz. And the first 99 participants, first 99 people to score a certain percentage will receive a certificate from Apollo Shine and Proton. You'll be receiving an e-certificate. So I kindly request you to go to our Apollo Shine Facebook page and do the quiz and grab your certificates, because only first 99 gets a certificate. So please go ahead and do that. And
great. Thank you. Thank you, everyone. Thank you. Bye-bye. Bye, Shalina. Thank you.
Thank you, ma'am. Thank you, everyone.
Thanks a lot. Bye.
Thank you for joining us.